The emergency room was overwhelmed, doctors were exhausted, and trauma victims kept arriving faster than the medical team could handle them. That's when janitor Marcus Williams stepped forward and began performing surgery with precision that left everyone speechless. Because the hands pushing a mop cart had once performed 847 trauma surgeries in combat zones across Afghanistan and Iraq. Welcome to Secret Human Stories. Before I tell you this incredible story of hidden expertise and life-saving intervention, tell me in the comments what city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button, because sometimes the most skilled healers are hiding behind the most humble uniforms. Marcus Williams was exactly what Metro General Hospital needed in a night shift janitor. At 48, he was reliable, thorough, and completely invisible to the medical staff who worked around him. For 2 years, he'd maintained the hospital's cleanliness with quiet efficiency, mopping floors, emptying waste bins, sanitizing equipment, and ensuring that every surface met the strict hygiene standards required in a major trauma center. The custodial staff appreciated Marcus's work ethic. He arrived promptly at 11 p.m. for his overnight shift, never complained about difficult assignments, and had an unusual familiarity with medical equipment that made him valuable for cleaning complex machinery. Marcus understood which instruments needed special handling, which areas required sterile protocols, and how to maintain the pristine environment that surgical suites demanded. The medical staff barely noticed Marcus, which was exactly how he preferred it. To them, he was just another custodial worker, someone who kept the hospital functioning behind the scenes while they focused on saving lives. Doctors would continue their conversations as he cleaned around them. Nurses would step past him without acknowledgement, and administrators would discuss hospital business as if he wasn't present. But there was something about Marcus Williams that nobody at Metro General could have imagined. The steady hands that pushed mop buckets and carried cleaning supplies had once held scalpels and sutures in some of the world's most dangerous field hospitals. The quiet man who emptied trash bins had once made life-or-death surgical decisions while enemy mortars exploded outside operating tents. From 1998 to 2018, Colonel Dr. Marcus Williams had served as a trauma surgeon with the U.S. Army Medical Corps, specializing in battlefield medicine and forward surgical teams. For 20 years, he'd operated in the most challenging medical environments imaginable: field hospitals in Afghanistan, mobile surgical units in Iraq, and disaster response teams in conflict zones where conventional medical infrastructure had collapsed. Marcus's military medical record was extraordinary by any standard. 847 trauma surgeries performed under combat conditions, with a patient survival rate of 94%, exceptional even for peacetime hospitals, remarkable for battlefield medicine. He'd earned 2 Bronze Stars, the Combat Medical Badge, and the Meritorious Service Medal with 3 oak leaf clusters. Among military medical personnel, he was known as a surgeon who could save lives that other doctors would consider hopeless. But Marcus's specialty hadn't been routine battlefield surgery. His unique expertise was what military medical professionals call mass casualty events, situations where multiple severe trauma victims arrived simultaneously, requiring rapid triage decisions and the ability to perform multiple complex surgeries with limited resources. These scenarios demanded surgical skills combined with command capabilities, the ability to coordinate medical teams while personally handling the most critical cases. The psychological demands of this work had been extraordinary. Every surgery Marcus performed meant someone's son, daughter, spouse, or parent might live or die based on his skill and judgment. The responsibility was crushing, the pace relentless, and the emotional cost of losing patients despite perfect technique had accumulated over 2 decades of service. Marcus's decision to leave military medicine in 2018 hadn't been about burnout or incompetence. It had been about finding peace. After 20 years of emergency surgery under the worst possible conditions, he'd wanted a quiet life where his biggest medical concern would be ensuring proper sanitation protocols. Custodial work at a hospital let him remain connected to the medical environment he understood while avoiding the life-or-death pressure that had defined his military career. For 2 years, Marcus had successfully convinced himself that his surgical skills were relics of a former life, that the hypervigilance and medical expertise he'd developed were unnecessary in his peaceful custodial role. He'd learned to clean around ongoing medical procedures without offering input, to observe surgical techniques without commenting, and to maintain the invisibility that allowed him to work without being drawn back into the medical decision-making that had consumed his military career. But some skills don't retire, even when the person carrying them tries to. And on Saturday night, October 19th, during what should have been a routine custodial shift at Metro General Hospital, those skills would prove that some duties never end. They just wait for the moment when they're needed most desperately. The night had started normally. Marcus was conducting his standard cleaning routine through the hospital's trauma wing, methodically working through operating rooms, recovery areas, and equipment storage spaces. The emergency department was moderately busy, typical Saturday night volume with a few accident victims, some alcohol-related injuries, and routine medical emergencies that kept the staff occupied but not overwhelmed. At 2:47 a.m., everything changed. A multi-vehicle collision on Interstate 95 had produced 12 critical trauma victims who were being transported simultaneously to Metro General, the region's only Level 1 trauma center capable of handling complex surgical emergencies. The accident involved a tour bus carrying college students that had collided with two tractor trailers, creating the kind of mass casualty scenario that overwhelmed even well-prepared emergency departments. Marcus was cleaning OR 3 when he heard the emergency announcements echoing through the hospital's communication system. Trauma Team Alpha to emergency, Trauma Team Bravo to emergency, all available surgical staff report immediately, mass casualty event in progress. Through the operating room's observation windows, Marcus could see the chaos developing in the emergency department below. Ambulances were arriving in rapid succession, paramedics were wheeling in patients with obvious severe injuries, and the medical staff was struggling to handle the sudden influx of critical cases that required immediate surgical intervention. Marcus's military medical training activated automatically. 20 years of mass casualty experience had conditioned him to assess overwhelming medical situations and identify the critical decision points that determined whether people lived or died. From his vantage point, he could see that Metro General was facing exactly the kind of scenario he'd handled dozens of times in field hospitals: too many critical patients, too few surgical teams, and the kind of time pressure that turned medical emergencies into tragedies. The first indication of trouble came when Marcus observed Dr. Sarah Chen, the chief trauma surgeon, beginning to show signs of exhaustion after her third consecutive emergency surgery. Dr. Chen was Metro General's most experienced trauma specialist, but she'd been working for 14 hours straight and was starting to make the kind of minor errors that Marcus had learned to recognize as early warning signs of surgical fatigue. The second problem was more serious. Dr. James Rodriguez, the hospital's second trauma surgeon, was operating on a patient with multiple internal injuries while two more critical cases waited for surgical attention. The time delays were approaching the critical thresholds that Marcus knew from combat experience, the points where delays became deaths, where triage decisions determined who lived and who didn't receive treatment in time. Marcus faced a decision that he'd hoped never to confront in civilian life. He could continue his custodial duties and watch people die because the hospital's surgical capacity was overwhelmed, or he could reveal his medical background and help save lives using skills he'd spent 2 years trying to forget. The decision point came when Marcus observed a 19-year-old female patient being wheeled into the emergency department with obvious signs of internal bleeding and respiratory distress. Her vital signs were critical. She needed immediate surgical intervention, but both trauma surgeons were occupied with other cases and wouldn't be available for at least 30 minutes. Marcus knew from combat experience that 30 minutes was too long. The patient would die waiting for surgery that he could perform immediately. Marcus removed his custodial uniform, thoroughly scrubbed his hands using the surgical preparation protocols he'd practiced thousands of times, and approached Dr. Chen as she completed her current surgery. "Dr. Chen, I'm Colonel Marcus Williams, retired Army trauma surgeon. I can help with the mass casualty situation." Dr. Chen looked up from her patient, initially confused by the custodial worker who was speaking medical terminology with unmistakable authority. I'm sorry. What did you say?" 20 years military trauma surgery, 847 combat operations, mass casualty specialist. The 19-year-old female in Bay 4 has internal bleeding that requires immediate intervention. I can perform the surgery if you'll authorize it. The desperation of their situation overrode Dr. Chen's confusion about why their janitor was offering to perform surgery. "You're saying you're a trauma surgeon?" "Yes, ma'am. Here's my military medical identification." Marcus produced the credentials he'd carried throughout his custodial employment, documents that identified him as a retired Army medical officer with full surgical qualifications. Dr. Chen examined the ID, processed the implications, and made the kind of rapid decision that emergency medicine required. "Colonel Williams, you're authorized to assist. Take Bay 4. I'll handle the coordination." Marcus moved to the trauma bay with the muscle memory of someone who'd performed emergency surgery under much worse conditions than a well-equipped civilian hospital. The patient, college student Jennifer Martinez, was unconscious with vital signs indicating massive internal bleeding, probably from liver trauma caused by steering wheel impact during the bus collision. Marcus began the surgical procedure that would save Jennifer's life. But what amazed the Metro General Medical staff wasn't just his technical skill. It was his ability to coordinate multiple medical activities while personally handling the most complex surgery. Nurse Patterson established second AV access wide bore, push normal saline, Marcus commanded while making his initial incision. Dr. Chen, the patient in Bay 6 shows signs of pneumothorax, needs immediate chest tube. Bay 8 appears stable for now but monitor for shock symptoms. Marcus was functioning as both surgeon and trauma coordinator, using skills developed during combat operations where single doctors had to manage multiple casualties while personally performing the most critical procedures. His hands worked with surgical precision while his mind processed the tactical medical situation that could save or lose multiple lives based on resource allocation and timing decisions. The liver repair was complex. A grade 4 laceration that required delicate suturing to control bleeding while preserving organ function. Under normal circumstances, this surgery would require Marcus's complete attention, but combat experience had taught him to perform complex procedures while simultaneously managing broader medical emergencies. "Respiratory therapy to Bay 4, Marcus called while completing vascular repairs. "Patient will need post-op monitoring for liver function and potential complications." Dr. Chen, who'd been observing Marcus's performance while managing her own patient, was witnessing surgical technique and emergency coordination at a level she'd rarely seen. "Colonel Williams, your surgical approach is exceptional. Where did you train?" "Multiple field hospitals, Afghanistan and Iraq. Mass casualty surgery under combat conditions," Marcus replied while closing Jennifer's incision. "This patient is stable, ready for recovery. What's the status on the remaining casualties?" The collaboration between Marcus and the Metro General Medical team continued for the next 4 hours. Marcus performed 3 additional trauma surgeries, repairing a ruptured spleen, addressing multiple orthopedic fractures, and conducting emergency neurosurgery on a patient with traumatic brain injury. Each procedure was executed with the kind of precision and efficiency that came from years of operating under the most challenging possible conditions. But Marcus's greatest contribution wasn't individual surgical skill. It was his ability to coordinate the entire mass casualty response using principles developed for battlefield medicine. He established triage protocols that prioritized patients based on survival probability and resource requirements, coordinated surgical scheduling to maximize operating room efficiency, and provided real-time medical leadership that transformed chaos into organized life-saving activity. By 7 a.m., all 12 accident victims had received appropriate surgical care, and 11 of them were expected to make full recoveries. The 12th patient, a 67-year-old bus driver with massive cardiac trauma, had arrived in a condition that no surgeon could have saved, but Marcus's rapid assessment had allowed the medical team to focus resources on patients who could be helped. Dr. Chen approached Marcus as he was cleaning up from his final surgery. "Colonel Williams, I need to ask you something. You've been working as our janitor for 2 years. Why didn't you tell us about your medical background?" Marcus's answer reflected the complexity of his transition from military to civilian life. "Dr. Chen, I wanted to leave surgery behind. 20 years of combat medicine, watching people die despite perfect technique, making life or death decisions under impossible conditions. I needed peace. Custodial work gave me that. But your skills are extraordinary. We could use someone with your experience on our trauma team." Marcus considered the offer, but his response revealed the personal cost of military medical service. Tonight was necessary. People were dying, and I could help. But this kind of pressure, these life or death decisions, I'm not sure I can handle that emotional load on a daily basis anymore. Dr. Chen understood. She'd seen other combat medical veterans struggle with the transition to civilian practice, where the stakes were equally high, But the support systems and camaraderie of military medicine weren't available. But the story of the hospital janitor's hidden surgical skills spread quickly through Metro General's medical community. Within days, Marcus was receiving offers not just for surgical positions, but for roles that could utilize his expertise without requiring the daily pressure of trauma surgery. The hospital's medical education department invited Marcus to teach emergency surgery techniques to residents and nurses. His combat experience provided perspectives on mass casualty management that civilian medical training rarely addressed, and his ability to perform complex procedures under extreme pressure was exactly what emergency medical personnel needed to learn. Marcus accepted a hybrid position that allowed him to continue some custodial duties while serving as a trauma surgery consultant and emergency response trainer. He could remain connected to the peaceful aspects of hospital work while using his medical expertise to improve the institution's capability to handle crisis situations. 6 months after the mass casualty event, Marcus received a letter from Jennifer Martinez, the college student whose life he'd saved during his first surgery that night. "Dr. Williams," she wrote, "I want you to know that I'm back in school, healthy and grateful to be alive. My family and I will never forget that you saved my life when you could have just continued mopping floors." Jennifer's letter made Marcus realize something important about his transition from military to civilian life. He hadn't really left medicine. He'd found a way to practice it on his own terms, using his skills when they were needed most, while maintaining the peaceful existence he'd sought after 2 decades of combat surgery. Today, Marcus Williams works at Metro General Hospital in a unique role that combines custodial duties with medical education and emergency response training. He still maintains the hospital's cleanliness standards, but he also teaches surgical techniques, develops mass casualty protocols, and serves as a backup trauma surgeon for situations that overwhelm the regular medical staff. The medical staff at Metro General now know exactly who Marcus is and what he's capable of. They respect his choice to work in a supportive role rather than returning to full-time surgery. And they appreciate having someone with his experience available when crisis situations require the kind of expertise that only combat medical veterans possess. Marcus's story teaches us something important about the nature of service and the different ways that military skills can benefit civilian communities. The trauma surgeon, who once saved lives in field hospitals, found a way to continue that mission in a civilian hospital, but on terms that allowed him to maintain the peace he'd sought after decades of high-pressure medical service. Sometimes healing comes from emergency surgery under combat conditions. Sometimes it comes from maintaining the clean, safe environment that allows healing to occur. Sometimes it comes from teaching others the skills that save lives in crisis situations. Marcus Williams learned to provide all 3 forms of medical service, and Metro General Hospital is better prepared to save lives because of it. The janitor who used to be a trauma surgeon became the janitor who still saves lives when circumstances require it. The hands that once held scalpels under enemy fire now hold mop handles in peaceful times, but they never forgot how to heal when healing was needed most. Marcus Williams proved that retirement from active medical practice doesn't mean retirement from the mission to save lives. It just means finding new, more sustainable ways to serve that mission while protecting your own capacity to help when help is needed most desperately.